Hi, my name is Wainberg, Associate Professor of Medicine, Co-Director of GI Oncology, and Director of Early Phase Clinical Development at the UCLA School of Medicine, Los Angeles, California. So screening for gastric and gastroesophageal cancers has been a big challenge, and partially that's a product of this not being a very common cancer in the United States. When we're talking about 50 to 60,000 cases a year, when you combine esophageal and GE junction and gastric, maybe 70,000 cases a year. We're not talking about a disease with enough incidence where vast screening modalities are shown to be effective. And what I mean by effective, I don't mean picking up the cases early, but I mean cost effective, which is essentially one of the principles of screening. In Asia, for example, in the Far East Asia, every patient is recommended to undergo an endoscopy, like we do in colonoscopies or mammograms in this country, in order to identify early gastric or early esophageal cancer. And that's because the cancers there are the most common, or some of the most common ones they see. In our country, screening modalities have been tested and not been successful, except for certain high-risk patients. And who are those? The first group is for esophageal cancer. Any patient who themselves have a strong family history, of course, is recommended to have early screening. And of course, also Barrett's esophagus. And Barrett's esophagus patients represent a small group, but patients who typically have had a long-standing history of gastroesophageal reflux disease and have evidence of some metaplasia in their distal esophagus, or typically in the distal, but could be anywhere in their esophagus for that matter. And it could be defined as short segment or long segment Barrett's, and also characterizing the degree of dysplasia, which the majority of Barrett's patients have already some low-grade dysplasia, but some could have high-grade dysplasia. And those mapping and procedures that are done by our gastroenterologists are critical to identify patients in whom they themselves have a high risk of developing cancer. Now, the majority of patients with Barrett's never develop cancer, and to some extent, the majority of cancer patients never really had Barrett's, certainly in the classical streamlined approach that we may think about it as. But it certainly is one recommendation that if a patient with Barrett's esophagus is identified, they should get screening on a regular basis, not just to identify high-grade dysplasia, but also, which is a precursor of neoplasia of cancer, but also other risk factors. Besides for Barrett's, there's other groups in which gastric cancer screening is recommended, particularly those with strong family history, or those where there may have been gastric cancer surgery in the past that has manipulated the milieu in such a way that may make them prone to gastric cancer as well. While there's no clear guidelines on these patients, they're often recommended to undergo screening based on individual risk characteristics. And one methodology to do that, of course, is by looking at each individual patient and understanding what their individual risk is for this disease. There is one rare genetic deficiency that is certainly a high risk, or almost 100% risk of developing gastric cancer. It's known as hereditary diffuse gastric cancer, which is a syndrome that is characterized by loss or mutation of a gene called CDH1 E-cadherin, in which it's autosomally dominant, transmitted from parent to child, which does put anybody who's a carrier of this gene at risk of developing gastric cancer. So certainly, if a younger patient with gastric cancer is found to carry this diagnosis, we always recommend full genetic screening, so that any subsequent family members, or any siblings or children for that matter, who get genetic screening and are found to have a CDH1 mutation are then themselves recommended to undergo screening for the entire family. And there is even data that carriers should undergo a prophylactic gastrectomy, because the risk of them developing gastric cancer is so extraordinarily high. And there are a number of other rare genetic alterations that we do recommend, certainly in young patients, genetic testing be done for patients with gastric cancer to identify any rare genetic mutations.